think the realization that Alzheimer's disease and other forms of dementia begin many, many years before the patients actually show the first signs of dementia raises the question of how do we identify patients decades before they become ill. And current approaches to diagnose dementia are based on the fact that the patients experience some symptoms of memory disturbance, or ability to remember, or to disorientation and so on. And then they go to the doctor asking for what's wrong with them. But by the time that happens, it's already too late. So it's very important that now that we know that the disease begins many, many years before the patient becomes symptomatic, that it's necessary to develop approaches, what we call biomarkers, of early disease, and then intervene on those biomarkers with some therapeutic interventions that we need to still need to be developed because we do not have. Perhaps some of the drugs we've used already in clinical trials, they've failed when given to patients with advanced disease. They may work in patients with very, very early disease or even before they become symptomatic. This applies also to diseases to vascular dementia-related conditions, because vascular risk factors, have an impact on the brain, decades before the patient gets sick. So, for example, midlife high blood pressure when you're 40 or so can condition whether you have dementia when you're 70. So even in that case, it's important, to intervene earlier. And for the vascular risk factors, it's easily done because we already know how to treat vascular risk factors to avoid, control high blood pressure, which is very, very, very feasible. And every doctor should know how to do that in most cases, how to control cholesterol, stop smoking and healthy life and so on. All those measures, can be implemented, at the time when the disease is starting to develop, as opposed to try that when already the disease is present. It has become also clear that dementia, as seen by the doctor's office, meaning community, dementia develops in the community, is most often a combination of a number of different factors. So the vascular components is really one piece of the pie that is responsible for the problems that the patient experience in develop the dementia. So we need to target those as one of the, not as going to be the solution to the whole problem, because many factors are also unrelated to the blood vessels, like, for example, the Alzheimer pathology in itself, like plaques and tangles and so on, or Lewy bodies or synuclein or other manifestation that we have, other pathologies we have. But I think the advantage of the vascular factor is that you can treat them. And we know already that we have very good, very effective treatments. And the incidence of stroke, for example, has declined by more than 60% over the past 40 years, probably because people take better care of their blood pressure, perhaps because they take statins, that they help with the lipids. Perhaps they do more exercise. So it is achievable as a goal. But that's in dementia is going to be only one piece of the pie, one slice of the pie, because there are factors which we do not understand very well that also need to be controlled. And for those, we may need specific treatments as opposed to controlling the risk factors. I think it is very important to realize whether that is right for them to do. Is it the right choice? Any kind of research is of interest, because researchers, no matter what field they are in, they're one of the few people, perhaps, you know, like the conductors, the orchestra conductors, that they go to work happy, you know, because they don't have to, the research, the process of discovery is very, doesn't sound like a job, you know, it doesn't feel like a job, only if that's what you really love to do. So it's very, very important that anybody who does research in this area or in another area, realize that this is really their passion. It's not a job like any other job. It's got plus and minuses. You know, the pluses is that you're completely free, and you can do whatever you want. You don't have to. You have a freedom in your day. You don't have to see patients every 15 minutes, like many doctors do. But you can go to work. If one day you don't feel like, you don't have to go to work. That's the plus, all right? The minus is that because of such freedom, you have to generate the resources to pay yourself and to do the research. So nobody is paying you to do what you like to do, all right? So you have to work at getting the resources, which is implicit in the job, because to be successful is also being able to generate the resources to support your science. So, but then you have no weekends, you know, there is no nights, there is no, you know, it's going to put stress on your family life. You may have a deadline, and you may have a situation in family that so there is all kinds of situations that arise. So the freedom comes with a price, and if that's really what but if you have a passion, you're going to overcome that, and you're going to be able to move forward. But if you said, okay, that's a good job for me, because, you know, I'm free or whatever, that's not enough, because that you pay for that freedom dearly. So that's the one. The other important thing is to find a good mentor. It's very, very important. Someone, you know, who cares about your development, and is able to tell you what are the trapdoors that you should avoid. And that's often young scientists, you know, do not realize, you know, what it takes, and there is a kind of a code of behavior. There is a absolute honesty that you have to have. You know, you cannot, you know, cut corners, because the only thing you have is your reputation, and that's all you have, and your word. Because nobody's going to check what you're doing in the lab, you know, every second. You go to a meeting and you present some data, but they take you for what you say, at your word, you know. And so if you lose that, if you make a mistake and you do not pay attention to that, and you end up, you know, rounding corners and not being absolutely honest, then that's the end of your career. Because, you know, you've lost your credibility. So to be sure to be always on the right path, you need someone who's going to guide you, and is going to warn you about what the problems and associated with your success. Even sometime, you know, you can have defeat from success if you take it, you know, goes to your head and you start to kind of cut corners and not behave correctly.